And
very well.
I won't name the physical therapist, but she actually said, like, I'm kind of bendy, but don't do that again. Like, I physically made her disgusted. And like by like in assessments and like how I was moving. And like I was there for hip mobility. And she's like, I'm actually really more worried about your shoulders. Well, sure enough, eventually my shoulders are a very big problem.
Yeah.
So she was right. But also, so she literally said to me, have you ever heard the term hypermobility? And I was like, well, no, except maybe like they kind of said that my hips were my pelvis was unstable.
Right.
And she's like, but you've never heard of it in terms of like an overall thing? And I was like, no. She's like, hi, will you please discuss this with your primary? And so I did. And like she had sent a report, and my doctor was
And when
in
was this?
private,
How old were you in this?
I was like 35, 36 maybe. So my
Okay.
doctor was in private practice. She wasn't part of this big hospital system.
Okay.
And so I did. And my doctor was also my daughter's doctor. And this is important to the rest of the story. And I'm trying to make this quick. But so anyhow, I asked my doctor about it, and she was like, no, that just means like you're overly flexible. You're just, you know, you have, the joint issues. I'm like, okay. I just accepted it and kept
So,
having devolving symptoms.
yeah. So you mentioned a key word there before you said hypermobile and you said unstable. And so I had some knee
Joint
problems after,
instability.
uh-huh.
Yeah.
Well, so I had some knee problems after I decided to take up running because I'm the type of
Oh,
person
yeah,
like
I did that too. I
I
did that too.
I'm like,
Mhm.
I've never been able to run. What's wrong? I'm going to make myself
I'm
run.
going to do it. I'm
And
going to.
I did, and I was like breaking myself apart. But I had this knee injury, right? And I remember, I went to the doctor, they sent me to PT. I got a little brace thing, but what they said was the joint's unstable. Do these exercises and it'll help improve or blah blah, like what I heard. And now I know this as an autistic person with communication issues, and it's, I heard do these exercises and it'll feel a little bit better. And the problem's gone. Problem's gone.
Yeah.
Oh, I'm going to stabilize it. I did my exercises.
Exactly.
I stabilized it. The
My
end.
body's going to let me stabilize it. Truth of the matter is,
Never going to happen.
you may develop better postural control and habits. You
Mm-hmm.
may strengthen yourself to give you a little more stability, but you're never going to be stable.
No. And that was key information that had I known that, because that injury was after I ran my first Ragnar race, which we'll talk about that one day.
That's a big, long run, in case y'all don't know.
That was 10 years ago.
Yeah. And I also was pushing myself with physical fitness and endurance. And I thought one of my things was I'm going to run a marathon. And then I realized I was having so many injuries and so much pain and problems. I switched to the water. So I was doing really intense weightlifting. I mean, like men were intimidated. I can lift.
Good. Oh yeah, I'm strong when I have, if I
Yeah,
can
I
actually
can
grip a
like
barbell.
it hurts me to lift my mug, like to drink.
Yeah.
But anyhow, like, so yes, I did the same things. And like when you're in your, I don't know, 30s or whatever, you think like, oh, I'm like, I need to take care of my body and this is how you do it. And
Right.
I want to keep up with everybody else, maybe even more so.
Right.
Anyhow, so I was like living the fitness life and all that. And then a lot of things happened for me, like in my life, that the pandemic
Yeah.
happened, and so I lost my physical coping. And I was coping because I had water cardio, which is amazing for us, and
Oh
I
yeah.
didn't even know it, but I was taking care of myself. I had bar and Pilates, and I had weightlifting, and it was like holding me together, but also mentally. And
Yeah.
then
That sudden change of routine was debilitating.
yes, but also like I could not, like I tried doing physical activity and exercises at home,
And
but
then,
it was not stable enough for me. So I developed more injuries.
yep.
Um, and then at the same time, my daughter, when she was 10, got very, very sick. And she developed a migraine that didn't go away for about 9 or 10 months of her life.
Yeah, I remember
She's
that.
a child. she's so part of that they were still in school, and then some of it we were, at home because of the
Right.
pandemic. And so we spent a lot of time, going to the doctors, a lot of time trying to figure out what was wrong, doing scans in and out of the children's emergency department. And even migraine cocktails weren't helping her.
Man.
And so my primary care doctor is also hers. And, we're just like at our wits' end and begging for help. And I was divorced, but she sat us down, my former husband, her father, with her in the room and said, maybe it's just anxiety or depression and she needs to see a psychiatrist.
You fired that doctor, right?
I fired her.
Okay.
And then the next time she was in the pediatric emergency department, the attending physician was a long-term, employee, had been a pediatric emergency medicine doctor for quite a long time. So keep in mind, this is an emergency medicine doctor. They're not generally adept at seeing these things.
Right.
And he was like, she's been in here how many times? Migraine cocktails don't work. And, we've done brain MRIs. There's some slight abnormalities, but there's like no glaring tumor or,
Right.
and, we've done all sorts of labs, and she had some kind of weird labs. She did have like positive ANA, which indicates a possible autoimmune thing. And she's been seen by a rheumatologist who did all the other testing and said, well, she doesn't have an immune disorder. Anyhow, so this emergency room doctor, who did have some long-term experience, though,
sounds like it.
said, I really think she needs to go back to rheumatology. I think her neck is too unstable. And I think that's what's causing it. And I was like, that makes complete sense. Now, keep in mind, I get migraines. I didn't so much as I think I did as a child, but now I realize, or what they've told me is I was, except they were considered abdominal migraines. So, like, I think we were getting both kinds.
What kind of
They're called abdominal migraines, like with the nerves are stimulated there for some weird reason.
Wait, you need to talk about those.
I don't even know how to describe it accurately.
Okay, well,
without having it in front of me.
We're gonna put a pin
We're
in
gonna
that.
pin in that. And it's also complicated. But so I, have been dealing with migraines, but part of my weird migraine thing was that I seem to have like different kinds of migraines, and sometimes it would respond to medication and sometimes it wouldn't. And I had been telling my doctor, who's the same doctor, that sometimes when my neck and my shoulders are really tense and they hurt really bad, I get migraines. And all she told me to do was stop lifting so hard that my trapezius muscle was giving me migraines. That was her answer.
Stop
that was her
moving.
answer.
Stop trying to be a living human.
Now I also know that I have an unstable neck. Anyhow, so that's when like he connected the dots for me. Now you should know, in case you missed this, I have medical training. And I had actually looked this up already. And I had found recently, in context of that conversation, information about EDS. But in the background, I thought, no, because like it would be worse, right? It would be worse. Not at all acknowledging the fact that she had a 9-month migraine, but I was thinking worse overall. And I didn't, like, my child is very, very bendy and has other signs.
Yeah.
But that was her complaint. She hadn't yet had other serious issues.
My daughter's primary complaint at about that age was headaches.
Yeah.
That's something that I want to bring up. And if any of our listeners can identify, I just want to let you know you're not alone, because you said something that I identify with, but in a different way. You just said you had medical training and you should have known, like it was.
I self-gaslit myself. Like I had heard enough.
Yep. You'd have been shut down
to
enough.
Find the answer. And then when I read about it, I thought, well, I feel like I'm too healthy.
You've been shut down enough to like just be like, no, I'm too
I've
healthy.
been very severely medically gaslit by my own family.
And also, because of that, even when you do complain, you minimize.
Yeah, yes. And also, and I see this very well in my child, when we express our experiences, we struggle to process feelings, including pain,
Yep.
and we struggle to communicate. And so we struggle to properly, in quotes, communicate what we're physically experiencing. And also, there's a physical disconnect because when pain is that severe, your brain and your body go,
Yep.
we're not going to talk about this anymore because it just hurts too bad. Okay. We're not friends.
Yep.
And so doctor said Ehlers-Danlos syndromes.
Oh.
And I said, that's interesting because I kind of read about that. And I thought, well, that could, but maybe not. And he said, I'm gonna have you see a different rheumatologist that is more aware of connective tissue disorders. And so, long story short, Evelyn was diagnosed with severe neck instability causing her migraines. And they did an evaluation. They took our family history and they said, yes, she has joint hypermobility syndrome. I asked about genetic testing and they said, no, we don't really think that's necessary. Then I started doing more research and I started getting more concerned about my own symptoms and our family histories. And you've already touched on some of those red flags.
Yep.
And so, long story short, they refused genetic testing. And I said, well, I'm going to show them. And I had her grandparents' DNA because what did I say my other special interest was? Genealogy.
Ancestry. Yep.
So because I do genealogy, of course, I do genealogy on our own family. And I used her grandparents' DNA and I took their data with their consent to a place where you can transport, bring your own data and use their software to view medical genome information.
That's awesome.
And I taught myself genetics.
I'm in the process of learning and I will be reaching out to you, I'm sure.
Yep. And I, in my head, as I was learning more about hypermobile EDS specifically, because that was the suspect, I found out that there were other types of the Ehlers-Danlos syndromes and other types of connective tissue disorders. And so once I found out that there was more to it and that there were more variants and there were more concerning variants, I had already had some preconceptions about where it came from in the family. And I thought, well, I'm bendy. My dad is super bendy. Like one of the running jokes is, his circus tricks, he can put his feet behind his head. And I can still do that. And I'm a 40-year-old chubby woman, by the way. I'm just saying,
I can get my foot to about here.
Yeah. I can chew my toenails too. I mean, I don't do that.
I did when I was a kid.
I did too. I don't do that now. I swear. I don't. I chew my nails now sometimes, but I don't chew my toenails. I feel like people are never going to believe me now. Anyhow, so moving on. So when I opened that up, I looked at my dad's first, and sure enough, there were all these genetic variants, and I was like, So I prepared this little report and I started taking line by line the parts of his genetic code and putting that in a report to send to her doctors. And it was very, time consuming and tedious. And so I thought, God, do I really want to look at this one? Cause it's not my mom's not going to have anything on it. I opened hers.
Dun, dun, dun.
She has, so I should clarify, both of my parents have pathogenic variants. I have multiple Ehlers-Danlos syndrome variants now genetically diagnosed.
Yep.
So I wasn't surprised by my dad's, but when I opened my mom's, she has the most pathogenic variant, as well as other variants. And she was the source of my recessive inheritance of several other EDS variants.
we'll talk about her another day. But I
Yeah, that's a whole other thing. But so part of the reason is in different variations of the connective tissue disorders, they don't all present the same. And in her variant, which is, we call it vascular EDS, but she also has arthrocalgic EDS, which I inherited. So she's kind of mixed in her presentation. Her hypermobility is generally in her fingers and her toes. And they are they're more hypermobile than me. Like we would always laugh at her because she would put her toes under her feet in a weird way, or like that. And I also, like, I have very long toes, but like that was never like comfortable to me, even though they're very weirdly bendy. But she
yeah.
would sit there like that and we would be like, ew, But, and then she also has very severe neck instability. She's actually had 2 spinal fusions. But I didn't, like, because of my preconceptions of all this.
Same. I had preconceptions too.
That blames all of it on being fat.
Well, that's what doctors like to do too. So,
yeah.
But my dad was just telling me, oh yeah, your Aunt Nancy just had some fuses and the nerve issues and the degenerative discs. And I was like,
what? Yeah. And well, and also it's very obvious in our families.
yeah.
Not only that, but the neurodivergence that goes along with it is probably more debilitating, to be perfectly honest. And more widespread. Like everybody in my mom's family, I would say, is just about autistic, but not all of them are dealing with severe hypermobility. The women are. The men, it's not as severe.
Tea helps them.
Yeah. Well, yeah. But so anyhow, I mean, that's a good point, is that it does vary across
it's a lot of
gender expression and hormone expression. Yeah. But so anyhow, I was not formally diagnosed until after my child was diagnosed. So I took those reports in great shock. And I mean, I probably wasn't that demanding. I'm going to be honest. I gave them a report and I said, please consider genetic testing. Here's why. Okay. And so they would not accept that to diagnose her, because obviously that's not what she inherited. But given the widespread
risk factor.
Yes, given the widespread information combined with our family histories and clinical presentations,
odds are it's not going on.
They then did say, okay, you know what? We're going to fit you in like 3 months. So it went from like a 2-year wait to like overnight.
So that's good. But you were going to do something else too, right?
Yes. So when they test, so they don't generally, they will send off a sample to a lab and they're going to test what they call a panel of genes. And so they're going to test a small selection. And there's different panels depending on how your doctor orders it, by the way. And so they tested a narrow.
So would that panel. Be like, let me get some clarification. So would that be like, if I go to the doctor and I get a blood test and they order a CBC and a lipid, like a CBC and a lipid test, that's 2 different tests. So even though they take my blood, if they do the CBC but not the lipid panel, I will never be able to know what my lipids were.
They don't know the rest of the story, right?
Okay, so that's what they did. They're just taking a tiny bit and testing.
Right. So they're only going through those portions of the genome. So that's what they did. They tested her, and then they were like, okay, these are the genes we identified. Now we want to test the parents. And so it's like $150, like a gene, a test.
Per
and so
gene?
anyhow,
per gene?
Or per like panel. And it's like $50 per gene. So they were like, well, we could test just like these couple concerning genes on both of you, and it'd be like $50 each. Or we could do a couple more panels and it'd be like $300 because it's $150 each. But so anyhow, so as I've been waiting, I tested myself. And I use a company that does a full genome. None of this, like, I just went outside of my insurance. I paid for it when it was on sale.
Yeah.
And I was, again, had a moment of being stunned. And I still wrestle with it. And one of the things that I found is a gene. And so like, then I consulted with a geneticist. Like, so let me clarify. Like, then I took that to geneticists, different than the one my child sees, but very knowledgeable. And they identified that I have something that used to be considered an EDS diagnosis, but is X-linked in presentations. And it was declassified because they see it more as a neurological disorder. And my daughter's brain MRI shows all of it. Anyhow, so
What's it called?
come to find out, that panel that they did not include this gene. So then I was like, you know what? That thing's on sale again. And so I have ordered, the tests to do it at home and then send it off to the lab to look at my daughter's entire genome. Because on sale, it's probably going to cost less than if we keep doing panels.
100%. And you'll have it. You'll have the whole thing.
And I'll have it. Instead of trying to like wait on her dad, who, like I already mentioned, we're divorced. I have no control over the man, but I need to be able to know how to treat my child effectively.
100%.
So anyhow, that's our next adventure in this. But so in that process, I tested myself. I saw a geneticist. I got diagnosed. I was 39. I was toward the end of my 39th year. I found out all those things. And here we are still waiting on getting my little one, the support that she needs. And that's my driving force, because I think back to all those things we talked about where like it's kind of like noticed, but not really effectively managed.
Same.
And I think a good point in this is that we can be proactive, even though we are middle-aged, and many of us are not diagnosed until middle-aged. The average age of diagnosis, is unfortunately our age. So like, I think that brings up, really good segue into our next episode. I think that's what we need to talk about next is diagnosis. We already kind of started touching on it, but
a little bit, but it's a lot going on. So we hope you stick around for that next episode.
Yeah, I don't know that we can top this.
That's a lot going on.
Yeah, that was a lot. But so thank you so much for sticking around, listening to all that, and listening to the Hacking Hypermobility podcast. We do appreciate you hanging out with us.
Yep. If you can take a minute to share this podcast or follow us and leave us a review and help us grow, just to spread the awareness. If you're a fellow zebra, we would like to hear from you, and please share the love.
Yeah. So wishing you healthy hypermobility and have a happy day, zebras.
Have a happy day, zebras. Bye.
Bye. Really, Annie?